I did not know what public health was, even though I had done my undergrad at UNC Chapel Hill. As a psychology major, I thought I wanted to go from figuring out the psychology thing and then being a clinical psychologist. As life would have it, I got married and moved to California and started working in a community-based organization really looking at issues of substance use and violence. And there really stumbled into population health and then this term called public health, and then realized that it'd be much cooler instead of working with one individual at a time, how could I work with communities? And so out of that, I realized that I needed to figure out what was next. Now, I was working on this cool project. I'd go back to DC and there'd be people on the dais, the stage, talking about communities of color. But there were two things that struck me. One, everyone had a terminal degree and no one looked like me. And so I came home and I was complaining, and my wife, who was a no-nonsense one in the house, said, well, if you're going to address the issue, then do something about it. And so instead of complaining, do something. And so that's how we began to figure out where could I go and what could I do. I looked at schools in California and then really started exploring public health, and like, oh, UNC has a school of public health. And so that's how I got back to North Carolina. But it really came out of understanding the power of affecting more than a single individual by looking at strategies and interventions that really focused on changing and improving populations of health. So most of the work and early interventions in the space were never developed for communities of color. They've been adapted. And so one of the things that I have really focused on is how do we develop interventions that are designed from the very beginning for diverse populations. The only way you do that is to be able to understand those diverse populations. And so you do that by gathering information from them, asking questions of them, and having them part of the process. And so in the same way that theories got developed for majority populations, the same thing should happen for minority populations, disenfranchised populations, and in the same manner and same result. So for me, it is critical and important that those with lived experiences be able to share those so that we can develop interventions and strategies that are really based on the understanding of those experiences. And so if we don't do that, we run the risk of having misalignment and sometimes doing more harm than good by not really thinking about it as a key and critical aspect of how we do work in community.